In recent years, we have made important progress toward the final conquest of tuberculosis, to a great extent aided by newer and better hospitals and sanatoriums. And naturally, as every health officer knows, such a hospital or sanatorium is the best place to treat tuberculosis when it is possible. With our elaborate equipment, constant and thorough supervision, and complete facilities, these hospitals help patients to conquer their disease. They give more effective help because they can apply definite principles of isolation, treatment, education, and rehabilitation. Every nurse has had some glimpse of these principles at work during her professional training and experience. The first element of tuberculosis care is the understanding between doctor and nurse. This understanding is vital to successful collaboration in the care of the patient. It is also vital to the relationship of the nurse to the patient and family. Always the doctor is responsible for making the diagnosis. The doctor also orders medication and plans treatment. The nurse is responsible for administering the doctor's plan. She shares with the doctor a responsibility for teaching patient and family. Seldom can we equal in any home the effectiveness of hospital care, but we can apply a number of the same definite principles which are familiar elements in contagious disease nursing technique. In the scenes which follow, you will see a typical family and a typical case for the public health nursing compared to hospital nursing. There are both similarities and differences in this case from the time the doctor in charge calls upon the public health nurse.
Miss Abbott, this is Dr. Cannell. I have another patient for you. The name is Evan. He has a wife and has 2 children. The involvement is bilateral. The sputum is positive. The family will need your usual instruction. Will you meet me there at 11, please?
11 o'clock. Yes. Yes, I know. I'll see you there, Doctor.
Like the nurse in the hospital, this public health nurse will follow the doctor's orders for treatment. But she must also pass on the responsibility for daily care to the family. Following the doctor's orders, she will help him to explain the treatment to the family and will teach some responsible member to follow out the routine of care required for the patient's welfare and for their own safety. You will see brief examples of teaching by this nurse. Keep in mind as you watch them that she has carried over to public health service from her hospital training 5 proven elements of teaching which you will see are used. Here they are, principles of teaching that are applied in all effective education. First, good hospital teaching is affirmative. The teacher must make far less use of don't than of do. Second, the item to be taught must be stated clearly in a few simple words. Keep instruction short. Third, the teacher must demonstrate what she has described. Fourth, the learner must demonstrate that he fully understands the instructions. Finally, use printed material as a reminder of your teaching. Get it from your health department or Tuberculosis Association. Printed material can never take the place of person-to-person teaching any more than a short motion picture can teach complete home nursing. But it can help make your teaching more effective by crystallizing the details of treatment. But when it comes to such a problem as the patient's morale, printed material is of little use. That factor must be governed only by the human approach. This element of morale is so important that even before teaching this family the routine of care and before showing the patient how to protect his family, the nurse tries to establish the right attitude in the patient's mind. She chooses her words and her approach carefully, explaining simply, trying to install the will to recover. She makes it clear that treatment is not just something we do to the patient, but something to which he must contribute. The patient's morale is one of the determining factors in his recovery, and it controls the extent of the protection he gives the family. With the understanding and cooperation of the patient, the nurse's work will be more successful. She must make him believe it is worthwhile to get well. The next treatment principle to be transferred from hospital to home is separation of the patient from the community. This can best be done when we remove the patient to a tuberculosis hospital or sanatorium. In a well-conducted hospital, separation from the community is combined with evidence that treatment is conducted for the patient's own benefit and protection. In the home, we must apply whatever we can of communicable disease nursing techniques. When possible, we try to assign the patient to a single private room. In any case, a separate bed is essential, and the patient must have completely separate equipment as well. Dishes, linens, and personal needs should be kept apart. The nurse explains this affirmatively as routine medical procedure without overemphasizing the isolation of the patient. She persuades patient and family that separation will protect the patient as well as protect others from his bacilli. She keeps the safety zone as wide as possible. Now she improvises visible barriers to symbolize the privacy of her patient, even in a one-room dwelling. Naturally, it is important to protect others from the tuberculosis bacilli, which invades every corner of the room. These paratroopers can carry tuberculosis from patient to family, but their near relatives carry colds and pneumonia from family to patient too. So a relative's cold can complicate your patient's illness dangerously. After this is explained clearly to the patient and family, the nurse leaves this printed reminder. The public health nurse has been hailed as a shoe-leather epidemiologist. Her teaching about infection provides a natural introduction to this part of her service, checking the patient's contacts. Here is a positive method of identifying all contacts, which has helped to find a lot of tuberculosis. There, represented by the square, you have the patient. A circle for the wife, the line of descent, and the two children. Shade the square for a known active case. Put a question mark for each known contact. Does the patient have any brothers or sisters? Show them. And here's your carrier, a sister who died of tuberculosis. The system is simple. Modify the basic idea, and it'll fit any family condition. It's an effective aid in finding cases early enough to make treatment successful. And now we come to our next factor of treatment, cleanliness. Simple cleanliness helps to fight tuberculosis. We cannot duplicate in the home complete hospital apparatus, but we can teach the value and importance of cleanliness. No case is so primitive that soap and water cannot be used. As a supplement to soap and water, explain the cleansing properties of sunlight affirmatively to the family. Teach the family that cleanliness helps to protect everyone, that they, as well as the patient, guard themselves by practicing cleanliness. Make the family understand how cleanliness, particularly with dishes and other objects used by the patient, is a fundamental necessity. And teach the patient, too, that his cleanliness will protect the family. He must learn to do his part to prevent further infection of himself and others. The use of disposable tissues must be made perfectly clear to the patient. The whole family must understand how to handle such contaminated material. This type of instruction shows very plainly the steps in effective teaching as they apply in the home care of tuberculosis. Watch now the application of these elements as we explain the disposal of contaminated tissues to the family. First, explanation. Then, demonstration show the whole procedure. Then you get participation by having the procedure carried out for you. Now, explanation, demonstration, and participation are repeated in stressing a second point in the procedure that the family must guard themselves to by constant cleanliness, here shown by washing the hands thoroughly after handling contaminated material. And finally now, the printed reminder covers both points in the procedure. We have purposely delayed the vital fifth principle of treatment, which is rest. For we need a foundation upon which rest will be possible and effective. Notice how the principles of treatment form a pyramid. Confidence in medical direction is essential in all treatment. Rest is a little more than a word until we establish the opportunity of complete separation and privacy. A clean bed and a clean body are great helps in relaxation and rest. Remember, the family has never seen bed rest in a tuberculosis hospital. You must explain it to them. Bed rest means being washed, bathed, and shaved in bed. Bed rest means, too, being fed in bed, not getting up for any reason. And most important, bed rest means a recumbent position, not sitting up until the doctor prescribes that change. Finally, bed rest means regular daily intervals of complete relaxation, rest for both body and mind. The patient may shorten his illness by giving hours each day to absolute bed rest. And it is necessary to explain gently, firmly, to the family and to friends that listening to others is not rest. The next important item is nutrition, not only what to eat, but the balance of meals. Talk in terms of a common sense menu which can be purchased by the patient's family with the funds available. The question of nutrition may well be taken up in the instruction of the second visit. In a fresh, sterile gown, the nurse teaches the family to avoid any contamination of the food supply. In planning a diet, assure the family that the patient makes little real gain by being stuffed, and that weight alone does not mean recovery. Show the family how to improvise a tray and how to make the food on that tray look attractive. The result will help to stimulate the patient's appetite and his intake of the right foods for his needs. Yes, even a meal that's good for you can be appetizing. Suitable recreation, when medically approved, is an important factor in inducing patients to accept treatment, whether in the hospital or in the home. Your instruction to the family is not complete unless you yourself have given some thought and provoked in the home some thought as to what the patient may do for recreation during his illness, especially when he becomes sputum negative. Now, here is an example of handwork learned from an occupational therapist and taught to the patient under the doctor's approval. As the patient continues to make progress, his reading time may be gradually increased. And now, with his recovery approaching, the public health nurse arranges for a conference.
Doctor, I came to see if the patient is ready for rehabilitation training. Mr. Bronson is from the state agency.
Yes, he should be ready to start on Mr. Bronson's plan the 1st of next month.
Figuring on 3 months' training, can we put him on a job when it's completed?
I believe we can count on that. Send him in for a recheck regularly while he is training. If all continues to go well, the physical demands you describe here will be well within his tolerance.
Thank you, Dr. Cannell.
Yes, here is our ultimate goal, the final reward for patient effort, care, and thought. To get the patient back on his feet, back to a job suitable to his condition and the future needs of his family, to make him a working, contributing member of the community. You may obtain printed material for the instruction of the patient and the family from the agency that arranged for the showing of this film. Make yourself familiar with all of the publications available from your local tuberculosis association.